We want to head now to Washington, D.C., where Senate Democratic leader Chuck Schumer out of New York and other Senate Democrats are holding a press conference on their health care proposal. Let's take a listen in.
You know, we often get in the blame game around here, but the one group that cannot be blamed are the Americans who are going to be losing their health care. They have no power to address this. So the Schumer plan here is a concrete proposal that would give security to folks in Vermont, and I'm going to be going to Nebraska and Iowa in my capacity as the ranking member of the Rural Subcommittee on Rural America and the Ag Committee. But I'm going to be talking to farmers out there who are going to be saying the same thing as that Northeast Kingdom farmer said to me. We want to protect the health care that families in this country have. And that includes Republicans, it includes Democrats, it includes independents. So we've got a concrete plan. We've had no response. And that means we're just going to abandon families and businesses and Americans who are going to lose in 2026 what they had in 2025. We got to pass this bill.
Thank you, Pete.
Thank you. I turn it over to Lisa Blunt Rochester, my colleague.
Thank you. First, thank you, Leader Schumer, for inviting me to participate. It's really good to be here with two senators who I had the honor of serving with on the Energy and Commerce Committee in the House. We did a lot of good work on prescription drugs, health disparities, and a whole host of other issues. And as I stand here, I'm literally thinking and watching the clock in front of me tick. The clock is ticking. Time is running out. There is a sense of urgency for those of us who are standing up here. And so I know the leader would say he doesn't consider this his plan. He considers this the American plan, right? That we do something. And I will tell you, as was said by my colleagues, I come from the state of Delaware. And anyone who knows Delaware knows that we are urban, suburban, rural, and coastal. We have farmers. We have small businesses. We have environmental justice communities that are impacted, even by CAFE standards. And so I will tell you, yesterday, when I was looking at my television and seeing our Republican colleagues at the White House, what I thought they were announcing was a healthcare plan. I was shocked that what they were announcing was something that would make us less healthy. And so as I stand here today, I think about the years of my work in this space of health. I served as Deputy Secretary of Health and Social Services in Delaware and got to see the impact of healthcare. I served as head of state personnel, so I saw healthcare from an employer perspective and how much it costs and how do you keep people healthy. I served as CEO of the Urban League, so I got to see health disparities and how in this country, as rich as we are, we have one of the highest maternal mortality rates in the world. So healthcare to me is a basic necessity. It's what drove me to run in 2016 and what I fought for. And times it's sort of like history is repeating itself or rhyming, because I came in, Donald Trump was president. Republicans had the House and the Senate. And as was said, there were calls for repealing and replacing the Affordable Care Act. What we recognize is that the Affordable Care Act is not perfect. But one thing I do know is that that family who has somebody with a pre-existing condition like asthma or diabetes is grateful. That parent who has a kid who's 22 or 23 is grateful. And so what we're saying here is very simple. We have an immediate problem, an immediate crisis, an immediate cliff, and we need to take immediate action. And that's why we're proposing the 3-year time frame to allow us to also work with our Republican colleagues to make the substantial changes that we need to make us a healthier country and to make sure that we have a healthcare system that's working for all of us. I came up here with a whole bunch of notes and really didn't use any of them because it's really that basic. It's really that simple. We're proposing something that will help right now, while we also give time to work together. I have stories of Delawareans, as my colleagues do, small business owners, rideshare drivers, young people who are concerned. For the first time, I had a resource fair. For the first time, people were lined up hugging me, saying, please help us. Please. And so we stand up here on behalf of the hardworking families. And we also stand up here to say, for anyone, including the president, to say that this is a Democratic hoax. Right now, people are looking in their email and in their mailboxes, and they have the receipts. It's happening now. And we need to act now. And so I thank you, Leader Schumer, for your leadership. I'm fortunate that I had the opportunity to also work with Senator Wyden on legislation, the Protecting Patients and Affordable Care Act, that focuses on not just the 3 years, but it is in tandem with this to make sure that some of the harmful things that were already done this year through the Big Beautiful Bill and through regulation are pulled back so that people, again, don't fall off a cliff, and that we're making sure that they're able to navigate this system. Again, I'm glad to be standing here before you, but I'll be happier when we pass this legislation. Thank you, and I yield back.
Thank you. Questions on this subject? Yes.
Leader Schumer, good afternoon, thank you. Are you concerned that Republicans, have this idea that Obamacare was, quote, the fault of the Democrats, that there's problems with Obamacare, that's why it needs this subsidy? 3 of the 4 of you voted for this in either the House or the Senate before, and that therefore they rely on that as a crutch to say, oh, this shows why Obamacare is broken, and therefore we don't have to do anything about it.
Shows you how out of touch they are. 55% of people who voted for Trump in November of 2024 support extending the credits. 55% of Trump voters. The Republicans are so much in a bubble. They're so out of touch. They don't understand the anguish and concern of the American people. Yes.
Can I add one thing to that, Chair?
Sure.
I also want to remind us that the disproportionate amount of people who are impacted by these tax credits not going into place are from red states.
Yeah.
Many of those states didn't expand
Yeah, look at them
Medicaid. And that's why many of them are the ones that are going to be impacted. So this isn't a Democratic thing. This is an American problem right now.
It's overwhelmingly supported by people in all parties, including Trump voters. Yes.
Over the last couple of days, there are a number of House Democrats that have presented framework, both bipartisan and the New Dems. Have you had conversations with House leadership about getting everyone on board in the House? I know you said that Democrats in the Senate.
The bottom line is the first thing that has to happen is to avoid the calamity that's going to happen is the 13 Republicans need to vote with us on this bill.
Is that
As for
realistic?
whatever House proposals there are, we'll always look at something. But I don't even see 15 Republicans supporting it right now. You have the Republicans having no plan, no unity. They're busy fighting with each other. Sure, an individual or 2 or 3 people can say this or that. It's not going to solve the problem. Yes.
You have talked about Trump being the key to all of this, and in the past have said that you would call him when the time is right. Do you think maybe the time now calls for a direct phone call to President Trump?
Trump calls this a hoax. What Trump ought to do is talk to the Republican senators and say, vote for this proposal. That's the way to solve the problem. That's just about the only way to solve the problem before the January 1st deadline. Then, I mean, look at it. They don't even have a plan. They don't even have 2 plans they're divided about. They're all over the lot, saying many different things, fighting with each other. It's crazy. It's just crazy on such an important issue that they would have that. Yes.
This bill obviously can't get to 60 votes to overcome a filibuster. Let's not pretend it can. But I understand Republicans don't have a plan, but why not propose something that has some of the tweaks Republicans have asked for? There are at least like 5 to 6 Republicans who said they would vote for an extension with an income cap, with
They
something
haven't.
that eliminates the $0
Okay.
premiums.
Ask them what they want to do on Hyde, those 5 or 6 Republicans. Yes.
Senator, why did the bipartisan talks to negotiate a compromise bill fail, in your view?
Well, you can talk to the bipartisan people who were talking, but in the views of the Democrats I've talked to, the Republicans never had a plan that could be even close to acceptable, and they were unwilling to deal with Hyde. I mean, Peter was part of those. Go ahead.
I mean, the bottom line is they couldn't put pen to paper. They couldn't propose something that was concrete, where they could say, we've got 4 votes, or 5 votes, or 6 votes. So it was aspirational discussion, but it never got concrete. So what really was the reality is that there was never an engaged discussion about how to extend these tax credits with specifics offered.
Plain and simple. Yes.
I'm trying to bring all this together in 2 questions, but to follow up, why not ask for that kind of meeting now, as you're saying the clock is ticking, and then 2, I'm still not sure I understand why you're putting this offer on the table, which is a non-starter for so many Republicans.
Okay.
Why there's something closer that could get through the finish line.
It is not a non-starter. 13 votes could solve the problem. That's where the onus should be.
They're
Putting
not gonna vote
something
for
together.
years.
No. Putting something together that 2 Republicans might support, when Johnson says he's not going to do anything, when half his caucus doesn't even want to repeal the ACA tax credits. Come on. Come on. The fault is there, not with us. And they can just vote for this, plain and simple. That's it. This subject. Yeah, go ahead, Peter.
I was just going to add, the only way you make progress is you get concrete. What we are proposing is concrete. It might not be the way some of the Republicans want to solve the problem, but they are not being concrete. And the clock is ticking, as Lisa was saying. So this is a good faith proposal. It doesn't mean that Senator Schumer would negotiate on our behalf if there was a concrete counter proposal that was made. But the Republicans really have been AWOL, and the president's been AWOL.
You can't find even 30 or 50 Republicans in the House, even 10 or 12 in the Senate, who say they agree on something.
Right.
So come on, it's ridiculous. Yes.
Thank you, Mr. Leader. If you don't get these 13 Republican votes that you're seeking and these subsidies expire, will you continue to push for a legislative fix, or does this simply become a messaging?
Look, we're always willing to
issue
talk.
for the midterms?
We're always willing to talk to people who want to lower people's health care costs. So far, there's no one to talk to. Thank you, everybody.
Thank you.
Look, just one last thing on
Go
that.
ahead.
You all have reported on all the House Republicans while they were home on vacation for, 90 days, 120 days, however long Speaker Johnson kept them at home. Dozens of them went to the camera and said that we need to extend these tax credits. You all have reported on them. You know the votes exist. You know this.
Not for 3 years.
But not a clean
Well,
extension.
do they want to do a 1 year, a 2 year, or 3 year? Put it in.
Does that imply that you're up for that negotiation for a year and
Ms.
a half?
Stefanik, who's running for governor, has been one of the folks that's been bullying Speaker Johnson. Thank God for that recently, for having the courage to do that and showing some backbone. I appreciate that. And she's told them 1, 2 years. There's others that have said 3 years. Some have said 1, some have said 2.
You know, the reason
Chad?
everyone's so excited here, excuse me, is because they have no plan, they have no unity, they have nothing, and you're saying, why don't Democrats do something? We are doing something. We're doing the quickest, easiest, simplest way to take the burden off the backs of the American people, and they ought to vote for it.
But you're open for a compromise, a year and a half, a year? I mean, that's what I'm...
First, they got to vote for this. We can talk
That sounds
about
like my
things
way or
down
the
the road.
highway.
This is the only solution to avoid the January 1st cliff. Plain and simple.
Chad, you know all the Republicans, man. Show me something.
Yeah,
You know
show
them.
us,
You know
show
them
us
best.
a group of them.
I mean,
You know them best.
There was a
Pull
group,
them in.
listen, to respond, there was a group of them this morning, a bipartisan group of more than 20 members, including at least a 10 or a dozen
In the House?
Republicans in the House.
Then Speaker Johnson should give them a
In
vote.
the
Send it
House.
over.
A one-year extension
have
that they're putting on the table
Speaker
today.
Johnson should give them a vote.
What did
and
they
send
say
it
about
over.
Hyde? Did you ask them? Is Hyde in it or not in it?
The
Ask them.
framework they had did not have Hyde in it.
I think they keep current
Yeah.
policy.
Thank you, folks.
Yeah.
Well, look, why doesn't the speaker give him a vote? He doesn't care. That's the problem. Mike's got to do the right thing here.
Thank
There's
you.
also not a single Republican House or Senate that's voting for a clean extension.
Why?
I don't, you,
'Cause they don't
honestly,
give a-
because they believe there's
you know why?
fraud in the program, they want an income cap, all
Well,
these
fine,
things.
then they should propose those ideas with whatever the reforms, that's what I've been saying. The first time I ever heard anyone say anything about these reforms in a concrete way is when Leader Thune lost his cool, because he was mad that we were asking for people not to go starving across America. And he rattled off 5 or 6. Has Mr. Thune put it on a piece of paper yet? I've not seen it. Maybe you all, we should ask him. You're gonna have a press conference for him in a little bit. He's not doing
But
it.
if you're putting a starting point to talks here at 3 years, the question is, do you want the issue or do you want to solve it?
Republicans
A
have-
3-year extension does
Republicans
not
have
read as
said-
actually wanting to solve it.
Since 2010, when I came into the House and we passed the Affordable Care Act, Republicans have said, get rid of it, we have our own plan. I don't know how many years it's been since then, but it's been a little bit.
We're asking you about your plan.
Well,
Right, the 3 years. 3 years is, it's
Republicans have
outside
said they're gonna
of the
replace
discussion.
this thing. Well,
Yeah.
put something on the table.
when the
What are
leaders-
they putting on the table? Do the Republicans care that their constituents are gonna land up in a hospital bed like I did, and then have to worry about trying to find a place to live because they're gonna lose their home or not be able to pay rent? That's what this comes down to. It's about affordability. I mean, it's nonsense, you all.
And I
Look at
guess the question is,
hold
why
on.
not
Look,
do
look
that?
at this shit right here. You guys see this?
Yeah.
Do you see this? I can attest to the fear that comes with sitting on a bed and not knowing if you're gonna live. I went through it. This is not okay for folks. I mean, I get the posturing and the this and the that and the votes and sure, step back and just, when you're not doing your job and you're worried about your life and your families, what are you thinking about? What are you thinking about? Like, I just hope that everyone can have that conversation because right now it's not happening. It's not.
But that's where I ask, you say 3 years, but Lisa said, others said.
Chad, you know all the
But
Republicans, you
that
show me
sounds
a
like
plan,
you
brother.
have-
I talk to your interns, I talk to everyone, show me the plan.
Would
They
you
don't
be
got one.
interested in a year and a half? That sounds like, when he says
I
this
ap-
is the only plan,
I
that's what she
applaud,
said of that.
maybe Liz Stefanik should run for speaker and come up with her own healthcare plan if she's running for governor and show Speaker Johnson what it takes to have a backbone and care about the
Well,
American
Johnson
people.
says the two of them work things out.
Oh, it looks like it, huh?
That's what she said.
Something.
Thank you.
Yeah.